Good afternoon, Miami Temple, and welcome to a program that's brought to you by the Miami Temple Health Ministries Department. Today we have a great set of panelists for you, and we'll be discussing our medical career panel. So without further ado, I'm going to give a little introduction about all our health panelists, and I will be asking them several questions, and afterwards I'll be opening up to the audience to ask several questions. So first up, I'll go by who I see on my screen. First, we have Lance Hundley, who is a physical therapist and graduated with a doctorate degree in physical therapy from Loma Linda University in 2017. He did his undergrad studies at Cal State University in San Bernardino, in California, and he's currently working in the field of orthopedics and pain management over the last 4 years. Beyond physical therapy, he's passionate for health, fitness, and wellness. Next up, we have Rawson Moss, who's an experienced registered nurse over the last 9 years with specialties in critical care, neurological, and psychiatric nursing. He's currently employed with the Miami VA and also Mount Sinai Medical Center. He's committed to excellence and driven by selfless service, providing the best patient care possible to those in hospitals and the surrounding healthcare communities in South Florida. He finds himself driven by honor, courage, and commitment as he currently serves in the United States Navy Reserves as a critical care nurse as of July 2019 and has numerous awards and commendations. Rawson currently holds a Master of Science in Nursing from Florida International University and is in the doctorate nursing program also at FIU. He belongs to a number of professional organizations, including the American Association of Critical Care Nurses, the American Association of Nurse Practitioners, and Florida Nurses Association. When not keeping busy, Rawson is usually found enjoying the outdoors at the beach or indulging in mystery novels or perfecting a variety of homemade dishes. And next on the screen, we have Chantal Guillaume, who is a retired registered nurse and obtained her Master's of Science in Nursing, with a specialization in health education from the University of Phoenix, Fort Lauderdale. She also obtained a Bachelor of Science in Nursing from the University of Phoenix and attended Jackson Memorial School of Nursing. She has an associate's degree as well, too, from Miami-Dade Community College and obtained a diploma in nursing at Jackson Memorial Hospital. Chantal worked at JMH upon her graduation from nursing school as a clinical staff nurse for 27 years in the antepartum or high-risk pregnancy unit, and 3 years also in organ transplant. Her career was not only dedicated exclusively to patient care, but she also advanced her studies and strengthened her knowledge in clinical practices such as pathophysiology, health assessment, curriculum design, with a specialization in health education. Her professional affiliations are as follows. She is in the Unit Practice Council. She serves as a chairperson in the GYN-ER. She is a co-creator of the Learning Center, a unit practice model project based upon interdisciplinary relationship-based care theory. She serves as a staff educator on clinical competence. She also participates in hospital project showcasing and unit activities towards magnet status attainment. She is part of the JHS Nursing Theory Council, the Haitian American Nurse Association member, the Biltmore Who's Who, and Quality Improvement Representative. Some of her honors include the Honor Society of Nursing, Sigma Theta Tau International, Nursing Excellence Award, Jackson Memorial in 2007, and Professional Excellence Award also from Jackson Memorial in 2007. Next up, we have Dr. Stacy Williamson, who was born in Southwest Michigan, but has lived in many states across the country. She attended college at Oakwood University in Huntsville, Alabama, which is a historically Black college and university, where she graduated with a bachelor's degree in biochemistry in 2010, and later graduated from the University of Cincinnati College of Medicine in 2015 as a first physician in her family. She completed residency in neurology at the University of Miami Jackson Memorial Hospital in 2020 and is continuing her training in the field of neurocritical care in Detroit, Michigan at Henry Ford Hospital. Professionally, her academic interests include equitable care for minorities with neurological diseases, diversity in medicine, and traumatic brain injury. Personally, she enjoys spending time with her family and friends, especially when a good meal is involved, music, movies, and fitness. And last but not least, we have Linda Cortez, who is an occupational therapist and a graduate of York College of the University of New York. And she has spent 20 years, she has spent the past 20 years growing and developing her clinical skills to help children be capable of functioning in various settings. Occupational therapy is the only profession that helps people across a lifespan to do things they want and need to do through the therapeutic use of daily activities or occupations. She hopes to encourage you this afternoon to find your passion diligently and pray over where God needs you most and let your life be a blessing to others. And I forgot to introduce myself. My name is Patricia Jeudin. I am also a physician and I'll be your host. I am a member of the Miami Temple Health Ministries, and I'll be asking the questions. I'll start with a set of just 5 simple questions, and then I'll open it up to the audience to ask any questions that you may have for each of our panelists. Are you guys ready?
Yes.
Yes.
All right. So let me pull up my questions. So first question, what made you choose your career? I'll let anyone start before I choose.
Hi, this is Roston. So I chose nursing 12 years ago because coming out of high school, I thought I wanted to be a pilot. Then I thought I wanted to be a doctor. And I found that nursing allowed me to do both. So besides being a critical care nurse, I have some training as a flight nurse. And that's primarily what I do in the Navy. So I was able to combine both. I did some research back then and I was able to see where I can combine my love for people and my love for flying. So that's why I decided to choose nursing.
Well, I'll go. I'm Chantal. I would say that I chose nursing because it was both personal and career oriented. As a child, I wanted to be a doctor, and I wanted to do something in for women in women's health. And I decided, I've tried many professions, but I decided to become a nurse because I felt that I could make an impact in women's life, especially as they transition from being a woman to motherhood with children, and help with the many social and emotional issues that women may face. And also, I feel like nursing is a great career because this is, in my opinion, the only profession that give you a lot of latitude, that you can do many things. There are many aspects in nursing that you can go to. You can go into education. You can go to technology. You can go to doctorate degree, depend on where and how you want to practice. So this is why I chose nursing, because I love being with people.
Hi, my name is Lance. I'm a physical therapist. So the short of what made me choose my career was simply searching and praying. You know, I thought for a while that I wanted to be a dentist. I wanted to follow in my grandfather's footsteps. So I thought that perhaps dentistry was going to be the place that I would eventually land. But as I began to shadow and look around, I found that there are a lot of professions out there that weren't quite the right fit for me. So as Patricia was explaining earlier, I am passionate about fitness and health and wellness. And I did find that I enjoyed helping people to find basically a healthy lifestyle. So which included fitness, you know, sports, helping people to find like the passion and enjoyment in health and wellness as well. Just trying to get people to also catch that fire. So as I started to shadow physical therapy, which I didn't think had anything to do with that when I was around 17, 18, 19 years old, I began to find that physical therapy is tied right in with exactly the things that I was passionate about. So right around the age of 19 was when I decided to switch my major from pre-dentistry to pre-PT. So that's the short of it.
I can go next. So for me, I didn't know that I wanted to do medicine initially when I first started college. I knew I wanted to do something that involved like helping people. And I had the opportunity to work in a physician's office between my freshman and sophomore year of college. And just like being around like the physicians and like the care and all of that, I was like, you know, this is something that I think I want to like pursue for a career. And so I changed from being more so like a biomedical engineer background to more so focusing on medicine, and then going to medical school to be a physician so that I could be the one that's like helping making those decisions regarding patient care, as well as, you know, providing some of my like background to helping people get better.
So I guess that leaves me. My name is Linda. Hi, everyone. I first knew I wanted to work with children from high school because I love kids. And I knew that I gravitated, that was my passion, was children. And so I started looking at a variety of careers. I was looking at teaching. I looked at physical therapy. And actually, when I graduated high school, my first choice was to be a physical therapist. But God had other plans for me. I did not thrive in the pre-PT classes. It was the physics and the calculus was just not going to do it for me. And so as I started to shadow a PT, I saw that there was an occupational therapist, and I saw what she was doing with a child. And I said, oh my goodness, I love this. I love what she's doing. I mean, she was just basically using play to get the child to move in a more functional manner. And I was hooked from the first time I saw her. And then that started my journey into becoming what I am right now. I knew I am a helping professional. I am a helping person. So knowing who you are is a big help in determining what your career choice will be.
Great. Just so the audience knows, we are going to go through certain preset questions, and then we're going to be taking the questions from the audience, but still continue to send them in. So the next question is, what steps or schooling did you need to take or did you need to do to reach your goal or where you are now?
I can start since I was the last one, right? So I went to OT school. There is a specialty in occupational therapy. However, I went during the years when you can still have a bachelor's and still work as an occupational therapist. But now people have to go for either an entry-level master's, a master's of science, and you graduate with an MS, or you can graduate with an entry-level doctoral degree. And the difference between those two degrees is basically that when you come out with a doctoral degree, you have a lot more background in research and in policy making than what you do as an MS or a master's degree, where you would simply be prepared to be able to go into the career or the field. And so that's the education that currently you need. But I did go, and you do have to do some observation hours. You do have to do some, you do have to go into a board certified program. So when you're looking at different colleges, you're looking at who has what kind of a program, whether a master's or a doctorate. That's it.
Well, if we're going in reverse order, I can go next. So for medical school, you have to obtain a medical degree after college. There are some places in the country where you can actually do a combined like undergraduate bachelor's degree along with your medical degree. That's like a 6-year program usually. But for me, I did the more traditional route, which is I did 4 years of college. I had to do a certain amount of classes as like prerequisites to get into medical school. And those are mainly like science courses and physics. Then I had to take like your entry level exam into medical school, which is called the MCAT. And then based on that score, that kind of guides you which medical schools you would be able to like apply for and likely to get accepted into. So then from there, I did medical school, and then when you're midway through medical school, that's when you have to be more serious about deciding like which path in medicine you want to take, whether you want to be a non-surgical physician or like a surgeon. And for me, the choice is pretty easy that I did not want to be in the operating room for the majority of my career. So I chose the non-physician or non-surgical path. And then once you choose your specialty, then you go into residency, where you just spend anywhere between 3 to 8 years, depending on what field you choose, and just learning more about that specialty, practicing that, with seasoned attendings, and then go from there and choosing any other subspecialty, which is what I'm currently doing now.
Surgery is so fun, though, Stacey.
It is. I mean, okay, I definitely enjoyed it, but I knew for me, it wasn't going to be for me.
Okay, my turn. Well, when I went to school in those days, you had, depending on the school that you wanted to have to attend, the college or university, you had to have an associate in science degree before you could get in the nursing program. So which basically consisted of all the science courses like anatomy and physiology, biology, biochemistry, chemistry, all the science courses, and then whichever accepted you attended. But I was lucky to find that at the time, Jackson Memorial Hospital had the nursing school. They had a 3-year program, which was reduced to a 2.5 years. So I found a scholarship there. I was accepted at FIU, but I chose Jackson, and their program was very intense. We had about 3 days of clinical and 1 day of lecture, where Jackson Memorial is a teaching hospital, so we benefited of all the whatever they were teaching the medical students. Like we were able to use their simulation labs. It was and we were like it was very intense. So we had like 6 months in each subject, like med surg, psychiatry, obstetrics, everything. So it was like 6 months until graduate management. And then I worked. They gave me a job because part of the deal was that you get the scholarship, but you give them 2 years, that you work for them for 2 years. And I ended up doing about 27 years. So it was a great program and I loved it. I never regretted it. And then I worked there for a while, then decided to got married, had children. So that was my priority then. Then I decided to get my bachelor's and then later on my master's, because I wanted to do patient education or staff education. So I thought I would, go down that path. But since Jackson Hospital was the only hospital that I knew, to me it was the world. So all my things was geared toward Jackson. So after I finished, they ended up closing the nursing school, so it was hard for me to get a job in education there. So I went in the private sector. I started teaching nursing, but it was not. It was like part-time until I retired in 2014. So that's my story. Okay.
Rossin or Lance?
Sure.
I guess I can go.
Okay,
I'll break
go,
the combo.
go ahead.
So if you're interested in becoming a physical therapist, what you have to do is basically you do your undergrad. So in your undergrad classes, you'll take a series of science classes, everything from biology to chemistry, a couple of mathematics classes. It doesn't get too difficult. But you take those for about 4 years. You come out with a bachelor's degree. It really doesn't matter what your degree is in, as long as you have the classes that whatever PT school you're trying to get into, whatever they require you to take, as long as they have those classes, then you can just have pretty much whatever major you want to. And then you go to PT school. It's 3 years there, and when you're done with your 3 years, then you come out with an entry-level doctorate degree, and you start working.
Okay, I guess I'm next. Again, just like Chantel said, for nursing, you want to know what's in your heart to take you to the next level. Like I said, I wanted to be a pilot, and I heard about nursing and combining it with being a flight nurse. So got into nursing school, had my prerequisites, got my associates in arts and associate in science, worked my way onto my bachelor's, got my master's. My master's is as a nurse practitioner, but my working experience comes from critical care. To be a flight nurse, I volunteered with Miami-Dade Fire Rescue. I then went ahead and moved on to Florida Advanced Surgical Transport Team, where I have over 300 flight hours. In the Navy, I do some flight training as well with them. But I would say start off with a good college. I chose Miami-Dade College because I'm a Miami son, Miami boy. Went over to FIU and back to FIU again for my doctorate. So go FIU.
All right, on to the next question. I just lost my page here. Give me 1 second. Okay. So, what do you find to be the most fulfilling about your career?
I guess I'll start off. Helping people in time of need. The greatest example I think any one of us on this panel can give is what we just went through, or what we're still going through, the pandemic. Being recognized as a first responder or essential worker, knowing that you're going into the fire, you're going into the line of fire, helping those, giving that reassuring voice, that reassuring touch, answering questions to the best of your knowledge, to the best of your ability, but just helping people, man. As a critical care nurse during this past year, I was able to save some folks, lost some folks. I also volunteered at a few testing sites, so we did some testing, and recently worked at a vaccination center where we gave some vaccines. So I saw the pandemic full circle. But again, given that reassuring touch, knowing that you are leaving your mark, and not just being, not just working in your pre-designated hospital, but knowing that you're helping the community at large. I think that's the greatest reward for me.
I'd like to add to that. I think another thing that maybe most of the panelists here believe, and this is wholeheartedly on me, I know that what I do for a living is my ministry. It is my ministry. I do have a part of what I do in church is yes, ministry, but my ministry extends outside of the confines of the church building. I have taken families to go get meals. I have taken families to the doctor's appointments that they need to go to. Like in occupational therapy, you become a family member to that particular unit, and you're supporting that unit for however many years you see that child. Most OTs do not do what I do, but I feel like this is an extension of what God has put in my heart. And I am his hands and I am his feet. And listen, if I have the chance to take you to a Publix so that you can get food on your table, I'm taking you there. So I do feel like when we go into a helping profession, we are not only helping that one person, but we're also helping all the other subsystems that support that one patient. So I think that's what is most fulfilling for me.
So I think Linda said it also for me also, is that being able to use your knowledge to help somebody else, using, have a compassionate heart. And not only the person that is in front of you, the patient, but it's the family system there, the whole unit. You have to understand what's going on with them, and also using resources on their behalf. It's so rewarding when you're outside of your working areas or your setting, and to meet patients, people that you have helped, and they recognize you. Sometimes I don't recognize them, but they see me, they stop me on the street because they remember the care that you gave, that touch, that loving touch, that that how you are advocating for them. Because being a nurse, or any of us in the medical field, is to be really a patient advocate, to stand for them. That's why I guess I answered my question.
Yeah, I think I would agree. I think when you decide to become any kind of healthcare clinician, you're going to be running into people that are going through they're pretty much their worst seasons in life. And the thing that you really rapidly discover if you work in healthcare is that human beings go through some stuff, like some stuff. And so sometimes people ask me, they're like, how do you work with people that are just in pain all the time? And I say, it really doesn't bother me, because you're an agent of change, and it doesn't matter what kind of healthcare clinician you become. If you're in this field, you're that balm for that person who's looking for either physical or emotional medicine. And just, the human touch is a, it's something that I think is often how do I say, it's really underestimated as far as the power of the human touch. So I think being in that situation is definitely, it's very rewarding, to say the least.
Yeah, I agree. I mean, everybody said it perfectly. Like, when you choose going into medicine, like, the number one reason I feel that most of us do it is because we want to help people. But like, as Linda was saying, like, I know for me personally, I felt like it definitely was a calling. Like, there were certain things that happened in the past for me to get to where I am that only God, could have directed me to be where I am today. And, speaking to what Lance was saying, that like empathy piece carries so much weight in the care that we provide to the patients, because, like he said, for a lot of us, because, I work in critical care also, where we're meeting patients and families at like the lowest point that they've ever experienced. And yeah, I may be able to, help with like the medicine part of things, but most of my job also is about having that empathy, having that compassion, being there for not just the patient, but also their families that like, I may not fully understand everything that you're going through because I haven't experienced it, but I can empathize with you that this is tough, and I'll do what I can to help to get you through this, whatever that ending is going to look like. So.
Great. I'm actually just going to do one more question for the list of questions, and I'm going to go to the questions that are coming in, because some of them are really good. So lastly, before we go to the audience questions, can you explain or describe what you do on a day-to-day basis?
I guess I can start. Basically, as a physical therapist, if you are working in a pain clinic, let me see, how do I Okay, so for what I do from a day-to-day basis, so I basically manage a group of physical therapist assistants. And so basically, when a person comes to the clinic with a problem, they come to me and they explain to me, here's my problem. I've been having pain in this area of my body for this many years, and this is what I've been having a difficult time doing. I can't, let's just say there's a, I guess for those of you guys that don't know much about the therapy world, let's just say you are playing basketball and you fall down, you injure your ankle, you twist it, and you think you're going to be fine. But then say 3 months later, you're still in pain and you're still limping. So basically you would come to a physical therapist, you come to the clinic, you see me, tell me about your problem. I would analyze the ankle and say, okay, well, here's what's still wrong with it, and here's what we got to do in order to fix it. Then from there, I hand you off to my team of people and I give them instructions as far as, okay, this is what I want them to do in order to get better. That's really the short of it. But also I do sometimes get to treat my own patients, in which either one, a person is going to need exercise to get better because either something's weak or something's too tight and they need to either stretch it or strengthen it, whatever it is. Or sometimes they need manual therapy. If somebody has a muscle that is just extremely tight and actually needs medical massage in order to relieve it, or any kind of other manual technique, then I also do those. So I'm trying to make the answer as short as possible, because there are a lot of cool things that you get to do as an OT or a PT in my case. But that's the short of it for me. So I basically evaluate the person, tell them what their problem is, and then I give them to my team to take care of the rest.
I guess I'll go next again. So as a nurse, on a day-to-day basis, a lot of my duties are surrounded by what we call the ADPI, or the nursing process, which would be assessment, nursing diagnosing, planning, implementation, and evaluation. With that, I can line up my day. I can line up my 12-hour shift or my extended shift. I can assess the situation in terms of what the patient needs, what the patient's going through. I can then formulate based on the medical diagnosis, what my nursing diagnosis is going to be. I then go ahead and plan how I'm going to carry out certain orders, certain tasks. I then implement those tasks, those orders. And once those are done, I go ahead and evaluate, was the medical treatment adequate? Was my nursing care, was my nursing touch adequate? And if so, we have that patient go on from day 1 post-op, or day 2 post-op, or day 1 admission, day 2 admission, possibly one day going home. And when I say going home, possibly one day, 2 days, I'm talking about maybe the next day or a few days afterwards. But that's usually how my day goes.
So I can go next. So I mostly work now in the ICU setting. So all of my care is basically provided in the hospital.
Can you describe what the ICU is?
Yes, so the ICU is the intensive care unit. So this is the unit in a hospital where the sickest of the sick patients are. Patients that require, like for an example with like nursing, either just only one nurse to this patient because they're so sick, or the one nurse will have like up to 2 patients. So for me, the beginning of my day will kind of start off with just going through all the patients in the unit that I cover, with like all of their data, like looking at some of their lab studies, imaging, things like that. The major portion of my day then is about rounding, and rounding is a term that we use where, as a group, which includes not only the physicians but also the nurse for the patient, we have a pharmacist who helps with making sure we're choosing the right drugs for the patient, as well as like PT, OT, to then come up with our plan for the patient for the day. So we take, the time to round on every patient in that systematic way. Once we're finished with rounds, then I usually spend my time doing any bedside procedures that need to be done. So patients in ICU settings will sometimes need special like IV lines that are placed by physicians, or other kind of procedures that have to be done as part of their ongoing care. So I'll spend a large portion of my afternoon doing that. as well as updating families, whether that's a phone call. And in the pandemic especially, it was even more challenging when we couldn't even have visitors in a hospital, where, you know, we had to take the time to call families individually, which is a very important part of the job. And then after that, just making sure that, you know, touching base with like the nurses, making sure that all the patient's needs are met and things like that. And then we do like a handoff where we give sign out to the person that would cover for the night shift, and then wake up and do it again in the morning.
Okay, I guess I'll go next. As I also, as a nurse, follow the nursing process. And part of that, what I'm doing now is that I'm retired. So I will be teaching fundamental of nursing to LPN students in a few months. But what I used to do, because depend on the area that you work. So I worked in the antepartum unit. So part of my my daily routine was you kind of get to your floor early, a few minutes. You get your assignment. If you are working as a floor nurse, you get your assignment, and then you go take a quick look at your patient to see if anything is going on with them. How is the shift, the previous shift, leaving you that patient? So, and some depend on the unit, you can round, like Tracy mentioned rounding. You go around with the nurse that is handing you those patients. So you look at your patients and they give you the report on what happened. So I used to work the night shift. So if I'm I'm turning over to the day shift, so I will give them report to what happened during the night. So what happened during the night, we do our assessment, or objective assessment, and our subjective assessment, meaning what the patient tell you, how they spend their days. And since I work basically with pregnant women, so most of the time we monitor them. We put them on the fetal monitor if needed, if it's needed, like if they have any complaints of abdominal pain, contractions, any bleeding. You know, we have to monitor them for preterm labor, all that stuff. So that was part of the routine. So if my assessment to be a charge person, so I have to get report from the charge nurse, the previous charge nurse, and I had to know about every patient on the unit and around, make sure that their IVs are okay. And I have to be available. I have to have the knowledge. I have to use my critical thinking, because in case of any emergencies, I have to be able to take over and help that nurse. Either I work with the nurse or take over completely. So that was part. I start IVs, monitor patients. So what I really like to do, I used to work also day shift on the antepartum unit, is that we had a system where you had to have patient education. So we encourage the patients to do their own lab, like the point of care. You know, your urine dip, you have to count, do your intake and output, how much you drank, how much you put out. And it's because they were long term, their admission to the hospital sometimes was the whole duration of the pregnancy. So it was a way also to make them active in their care, to know what was happening with them. So that's the part I like about teaching the patients also. I also work in the OB triage area, which was the OB/GYN emergency room. So part of my duties were to receive the patient as they come in. So you have to really, as they come in with different complaints, bleeding, rupture of membrane or contraction. So you have to be able to act quickly, to work with the midwife in the ER area, and then they had to do their part, assessing to see if they were really in labor, and then you monitor the patient. You put them on the external fetal monitor, and then the day was, going on like that. It was like a revolving door. A lot of GYN bleeding, a lot of OB patients coming. I work also in the transplant unit. Part of it was very intense. and we had to administer. You do your assessment, you do your vital signs, but there were a lot of drawing blood in the morning. So we could have like 16 tubes of blood that the nurses only had to do, because the patients had different ports and only the nurse could do those blood drawing. Also, I was certified in bone marrow transfusion. We had to prepare the patients before they do their transfusion for bone marrow. So you had to be certified for that and administer quickly. So this was a very fast pace. You have to act so quickly once they call you for a patient to be transfused. So it's like you had to do 1, 2, 3, administer whatever the medicine, I forgot the medication was. So that was the day until my 12-hour shift. And then at the end, you turn it over and the person take over and start the same routine.
So in occupational therapy, I work in a different setting. I do not work inpatient rehab. I do work outpatient rehab, which means that we do get children on a weekly basis to come in for evaluations. And what that evaluation determines, and most therapeutic practitioners have to use problem-solving skills. You look at a child and you say, okay, what is the biggest limitation that this child has to functionally participating in their home environment or in their school environment or whichever environment they're involved in. So you look at that and then you start coming up with a plan of care and what are the goals that you want this patient to achieve within 6 months and within a year. But daily, I see about 35 patients in a week. And that's broken down within 4 days. And I see patients for half an hour to 45 minutes. My patients are either from age 1 all the way to age 21. A variety of diagnoses. I see kids that are autistic on the spectrum, Down syndrome, cerebral palsy, cancer, children that we just have a variety of diagnosis, and then we have a variety of limitations. Is this child limited in their hand use? Do I need to fabricate a splint or something special so that they can extend their hand and keep it functional? Or do I have to work with this child in motor planning? Does this child not know how to catch a ball because they just don't have it in them? They don't know how to do it. So I have to think fundamentally, what is the most important thing that this child will benefit from occupational therapy? And then I take it from there and I see the child either twice a week, once a week, whatever I determine as a therapeutic practitioner. And I have to write notes. Every day I have to write a note on each patient that I see, and I mark down their progress, or I mark down that we didn't do any progress today. So that is where I'm at in OT.
Okay, perfect. So now we're going to get to the audience questions. And just for the sake of time, I'm going to ask 2 volunteers to answer the following questions. So I'm going to ask a question from Miami Music Man, and he says, how have you kept yourself from getting burned out or jaded in your career? You have seen so much and experienced so much stress that I'm sure you're grateful for breaks, right?
I guess I'll start off. Work hard, play hard. You must know how to have a balance between your work life and your personal life. Yes, we all here on this panel, we provide healthcare. We love what we do, but we do understand that from time to time, we do need to take a step back, rejuvenate ourselves, rest, relax. We understand that, yes, it is our mission, but we do know that in order to take care of those, we need to be able to take care of ourselves. So exercise, kudos to my physical therapist here on the panel. Exercise is very important on your days off. Enjoy the outdoor, like Linda said, work out, throw that ball around, and just take care of yourself so you can be in the best position to take care of others. And that's how I think you avoid burnout.
I'd like to say something in terms of jading in the career. There's no career is perfect. So you're going to come into politics in your career, in your hospital, in your outpatient setting. There are going to be things that you like to do and things that you don't like to do. Me personally, I don't like to write my notes. I just don't like it. That's just personally my thing that I don't like to do, but I still need to do it because professionally, that's what justifies what I do.
Yeah.
So you have to do the things that you don't like to do. And to keep yourself unjaded in your career, you always come back to, what am I doing? When I leave my door, am I happy that I'm going to go see a particular patient? Yes. And just go in there and ask God, because that's what I do. I always pray before I walk into the building, God, make me a blessing for somebody today. And that's how I stay unjaded.
Nice. I love that. Thank you for that advice, Linda. Okay, so next question. For those of you who have been in your careers for many years, how has your profession changed? How has technology influenced it? And would you still have chosen the same career now, knowing what you do now?
Well, I think I'm the one with the most more years. Yeah, I think technology definitely has changed the nursing profession because to me, the years that I spent in school, the schooling is different because now you have technology. You can be in a classroom teaching nursing students, and then the effort is less because they can Google everything. You know, their information is from is a quick fix. It's, to me, it's like a quick fix. Nobody spend time anymore to learn, to research. As I studied, we had many resources. So we need to use the resources that are available. This is how you learn. The pharmacy, the social worker, the physical therapist. These are the interdisciplinary people that you're going to use in your career. So you need to know about them. You need to have a relationship with them, and you need to use them. So it's not an island. And technology definitely has changed the nursing profession. And I think new nurses, it is sad to say, this is my observation, probably will lack the skill, especially the touch that we talked about previously, because we're going fast. And I've seen so many ads on social media about being a nurse in 2 months, in 1 year. And, you know, and it's heartbreaking because when you have to be able to use your critical thinking when you are facing emergencies. You have to know when a physician make a mistake. How are you going to catch it? You have to know about the medication that you administer to the patients. You have to know how they react to certain medication. You have to know about their social life, what is affecting them, what is their emotional, what is affecting them emotionally. So we're not fixing only the blood pressure, the high blood pressure or the clot the patient have, but we are treating the total being, the holistic approach. So yes, we need to, I think it's turning to that. It's like a quick fix, and I don't think nursing can be a quick fix. It's too much involved.
I was going to ask Rostin for a rebuttal, but I'm not going to do that.
No offense, Rostin.
Just joking.
No, because there are different aspects of nursing. Like it chose to be what you're doing, pilot, emergency nursing. So
Yes.
that's what I said. It's so wide now that you can go so many places with nursing, but the essence of it,
Yes.
you cannot go too far from the basics. We still need it.
I think the next question might be for Stacy. And also Rossin, because you're also working at a hospital. Specifically for those working at hospitals, there are many happy days, but also sad days at your work when patients are suffering and some die as well. How do you deal with those sad days?
Yeah, those days are rough, I'm not gonna lie. Especially when it's been a patient that you've been caring for a long time, whether it's, for like weeks, months. And what I found to be helpful for me is that I've accepted that I'm not a robot and that it's okay to feel sadness and a loss of a patient. There are some others in medicine who feel opposite, that you should not have any emotional attachment to your patients and whatnot. But for me, that wasn't how I wanted to practice. And I knew that there were going to be days like this where the outcome was not going to be favorable. I've cried when I've lost patients, because sometimes it can be a traumatic experience for the family, but for obviously and most importantly, but also for everybody that's been involved taking care of that patient. And it's okay to feel that way. When things are maybe at a higher stress level and the emotion becomes overwhelming, sometimes I will excuse myself from the room when I'm talking to family, or after we've had to pronounce a patient, where I've just taken a few moments to myself to kind of regroup. I often pray in those moments for God to just kind of put my heart at peace, knowing that I and we as a whole team did the best that we could for the patient, and that at the end of the day, God made the decision that that was it. And I think just taking that time for yourself to accept those unfavorable outcomes is what really helps in the long run, because I've seen colleagues who they don't show any emotion whatsoever, when they've had bad outcomes, and then those people burn out, they lash out, at the littlest of things, because they're not taking that time to kind of process all of those emotions. So that's what I've done. And then also the beauty of critical care too is that yes, we do see losses, but we see miracles happen as well. And it's those experiences where you have a patient who nobody thought was going to make it out of that bed to come and walk back into your, critical care unit, that helps reinforce that what you're doing is worthwhile, and you're able to hold on to those things that, for every patient that you may not save, there's however many more that you are able to save.
Yes, to piggyback on what Stacy said, and to answer the two-part question, suffering, how can you help someone who's suffering? It may not all be the medication. It may be a simple conversation. It may be the non-pharmacological methods of just talking to someone, trying to relate to them. I know for myself, being from the Caribbean, I'll always try to help someone with a hot cup of tea, or ice cold ginger ale, or an extra fluffy pillow, or maybe a warm bath. As being a male nurse, it is hard sometimes to get someone to be that much more vulnerable with you, especially when they're sick, especially for the female patients. But some female patients have said, hey, I prefer having a male nurse because you guys tend to be a little more gentler than the female nurse. No disrespect to my female counterparts, but the male hands, or the male perspective, or the male touch may just be a little bit different, maybe more softer, more caring. So to help someone who is suffering, you try to go more holistically and non-pharmacologically. Take someone around to walk around the ICU, show them different points of views, and tell them, hey, your situation may not be so bad. Look at this other guy or this other person over here that's connected to all these machines and tubes and so many things going on. And you just reassure them that, this too shall pass, or whatever you're going through. It may seem like the worst thing in the world, but you're not the only one. You will get through it. And how to deal with someone who is dying or has passed. Again, going through COVID, I have lost a lot, but seeing those miracles come through, seeing folks from ECMO machine to lines here and central lines there, and so many different modalities. And to see that person bounce back, weeks later on, it's rewarding. I've been doing critical care for 10 years now, and how do I deal with the loss? Unfortunately, I just have to, once I clock out, leave it there. I can't afford to bring it home with me. I can't afford to bring it home and allow it to change my mood just because I have to come back the next day and do it all over again. I have to be a functional and a functioning individual. I leave it all there saying that I did the best I can, did the best that I could. And it's not all on one person. It's a team effort. Doctors, physical therapy comes in, get those patients out of bed. Occupational comes in, working with short patients, get them back to, using that right hand, that dominant hand, that left hand, getting them to bathe themselves again, tie their shoelaces. I guess what I'm trying to say is you warrant those small mercies, those small victories. So that's how I go through those tough situations.
Thank you. So I think this next question would probably be geared more towards Lance, Rostin, or Linda. So the question is, are more programs in your professions going more towards doctorates instead of masters?
Yeah. So for the physical therapy side, it's definitely leaning heavy towards doctorate. I mean, I think it really varies from state to state, but pretty much everybody across the board. For PT, you have to be entry-level doctorate. You can still practice with the master's, so if somebody has a master's in physical therapy, it's not obsolete, but for a lot of us, even though who are graduating with their doctorates, even though, yes, we are graduating with a doctorate, there's still a huge level of respect for our predecessors who are still here with their masters, because we recognize that, yes, we have our doctorates, but we also respect their experience, because they've been in the field a lot longer. But yeah, to answer the question, at least in PT, it's pretty much all doctorate.
And I'll piggyback on Lance. And yes, whatever PT does, OT follows suit within a couple of years. So yes, entry-level doctorate is the way to go for OTs. There are still master's program. FIU has a master's program. NOVA has a master's program. University of St. Augustine has a combination of OT, PT, doctoral program. So yeah, I mean that it's the wave. That's what's coming in now.
Okay. Next question is, what changes do you see of your profession's future? Will it increase or decrease in demand?
I think the nursing profession is very much in demand, especially now. They are very much in need of nurses at all levels.
I think all of us are going to remain in high demand. We're never going to be replaced by robots.
That's
You're never
true.
going to get an MD or a PT or a nurse or an OT that's going to be replaced by a robot or anything. You're always going to need a human mind to be able to deal with a person's issue. So no, always demand. I think that's Auntie Judy asking the question. Hi, Auntie Judy.
Excellent. Someone also asked, how do you practice self-care and find time to rest? Hashtag invest in rest.
Hashtag Sabbath.
Yes.
Anything outside of Sabbath?
Well, I know, like, for me, I work in a schedule where I do like an intensive 2 weeks, and then I always have like a Monday off after those intense 2 weeks in the critical care unit. And that day is where I take to I sleep in. I, do things that I want to do, catch up on my own health, whether it's like going to the doctor, dentist, whatever. And, just really utilizing my off time to really help reset myself like mentally. While I'm working, I try to exercise when I can, but not to the point that it becomes another stressor. But to the point that it's just helping me to continue to get through the days. And then like Rostin was saying earlier, like I have to protect my own mental space and try to not bring all the stress of work home, because home is like my safe space where I get to like reconnect with family and all of that. So try to leave all the stress where it's at in the hospital and then come home and just like decompress and be with family.
Anyone else before I go to the next question?
And just be grateful you live in Florida where you can indoor and outdoors. Hint, hint, don't move away so far.
I think also once you put your time in, then you can start saying, hey, I don't want to work 5 days a week. I only want to work 4. And then that one day that you're off, that's when you just take advantage and you can sleep in and do whatever you want to do on that day. And that is your day off. So definitely like when you're younger, I know I work with all of my therapists that I work with are younger women, and they're constantly like flying to Mexico or flying to other parts of the world. That's their way of, getting away from the stress of work. But I'm at a point in my life that I'm a homebody.
Okay, next question. There are many TV shows that showcase different medical careers. Do you think this has harmed how people see your profession? Have you encountered any stigmas from your patients? ?
That's the medical.
The answer is yes.
Medical.
Yeah, I won't say the TV shows have harmed it, but it definitely has left a lot of stigmas out there, like Nurse Jackie, Grey's Anatomy. People think that those things actually happen. I mean, maybe they do, I don't know, but that's not the real deal that we all know and share on a daily basis. I don't know.
Well, people always ask me, what do you do in occupational therapy? You find people jobs, and that's, then I have to explain the whole thing to them. But that is, people don't know what we do, thankfully.
I think you should also answer this question, Stacey. There are a lot of doctor shows out there.
No, like most of these shows just focus on all the like drama between like, the professions. And I feel that overall, like, because we all work together so much and we're so integrated, like there's many specialties sometimes caring for like one patient. And, every now and then we may like bicker a little bit about something, but for the most part, like at the end of the day, we're all just trying to help the patient and we, work well, like with one another. So yeah, that whole, like all that relationship drama and all that other stuff, I'm like, that's just more maybe extra. Yeah, I don't know. It has its pluses and minuses.
I agree. I mean, I would also say, I'm not a panelist, but I would also say it's hard to watch when you're seeing someone do something incorrectly medically, like CPR. Yes. You're like, yes. No, that's not how it's supposed to happen. Right. Or putting in the IV line, or someone having surgery, but they're not intubated. They just have a mask on, and you're like, this is not
how this works. Yes.
Okay, so the next question is, how do you see the church helping the community? What areas can we focus on?
I think health education could be an area. Educate.
I'm going to ask everyone to chime in for this one.
In terms of health, I guess the church, the Seventh-day Adventist Church, our faith is grounded on the health ministry. As healthcare professionals, making sure that our patients are healthy in our respective scopes of practice is one. As Adventists, getting that health message out there would be the number one way of connecting to the community. Folks have been home in the pandemic lockdown, and I'm pretty sure a lot of chips and cookies and shelved items may have been bought, but how would have maybe homemade goods help families, homemade bread and homemade cookies, the more healthy options. That probably would have helped the community, I'm guessing.
And then to kind of echo what Chantel was saying, with the education, also doing like various health drives where maybe you're, going out in the community and, as you can, depending on who's available, like, doing health screens and, giving information for clinics nearby, things like that, so that the community sees that, we do take every aspect of the person seriously, including your health.
I would like to see my church be a respite for families of children that have autism, where parents can go and maybe spend 2 hours and either do their nails or go shopping without their child and spend time for themselves. And I wish our church could embrace that, because I think that would be a great benefit to the community. There's so many children on the spectrum that parents feel they cannot leave them ever because there's no one there to support them.
I love that. I think you can also apply that for patients who, are parents who have kids with special needs too, outside of autism, like cerebral palsy and all of that stuff. Because a lot of parents do feel like they don't have anywhere to turn to.
And we have specialists like nurses. We have nurses that can come in and just be there. It doesn't mean that they need to be used at any moment, but why can't we offer something like 2 hours? You have 2 hours to go do your Christmas shopping. Go and take care of your family in another way by taking care of yourself.
Mm-hmm.
Okay. So since there's no more questions from the audience, I'm going to ask another question of you guys. What advice would you give to someone who wants to go into your specific field?
I guess I can share on this one. Biggest thing I would say, well, first, obviously, is pray about it, because there's no amount of searching or research or shadowing that you can do to really know what you were meant to be. So the disadvantage I think sometimes that a person has if you don't have God is you're trying to figure out what you were meant to do by asking other people, like, what can I do? And so that you're always going to be limited. So if you want to find out the way, let's take a machine for an example. If you want to figure out how any machine or any computer works, you have to read the instruction manual, which comes from the manufacturer. So the same way, as a human being, if you want to figure out what you were meant to do, you have to go to your manufacturer. You have to go to God, because God is the one who actually knows. He created you, so he knows exactly what you were meant to do. Before you even took your first breath, he installed purpose in you. He installed an anointing in you, and he knows all those components. And so the first thing that you got to do before trying to figure out what you want to do, it's not the books, it's not Google. Google can't tell you. Your mom and dad can't tell you, with no disrespect to them. But the closer that you develop a relationship with God is the more he's going to show and reveal to you the talents and gifts that you naturally have installed in you. And those talents can really develop passions for certain things and really reveal to you, man, like certain things that you can really use to make a positive impact for yourself, your family, and most importantly for his kingdom. So that's really the first thing. The other thing is, in terms of being diligent and actually looking and searching, I would say shadowing, at least for me, was a big part of it, because as much as being a physical therapist or a nurse or some kind of physician, the many types of physicians there are, It may sound like a good idea, but you don't really know what that's going to look like until you actually go there and watch them and say, okay, let me spend 8 hours with a nurse or with the physical therapist, or maybe you don't have to spend that much time, but at least spend an extended period of time watching them, and then put the picture in your mind and say, can I see myself doing this for 8+ hours a day? Like, can I do it for that long? Or is it something that just kind of sounded like a good idea in my head? So I would just really put those two at the top. I'd say go to your manufacturer, which is God, and develop a relationship with him, because his door is always open. That'd be the first thing. And the other thing I would say is shadow.
Yeah, I agree with Lance. You have to find what God has in, which direction He wants you to go, and what is your purpose in life. And being able to shadow somebody, like he said, I don't know if we have such a program. We used to be able to do that. I remember we had the program taking your child to school, to your work, to your place of employment. And I remember taking my daughter to my job, and my gosh, I had to find a place for her to sleep because she couldn't stand seeing blood. It was definitely not for her. Medicine was definitely not for her. So I think, like you said, Lance, it's important that if it's possible to really know the who you want to be, that profession that you want to get involved in, that you'll be able to observe a person that is in that profession and see how you feel about it.
I think another thing to add to what's already been saying with, being in commune with God, with this, what your calling is, shadowing, that another part for me that I found important was surrounding myself with people who had similar goals, because these will be the people that help you with like motivation and, going along the journey that you can relate to, and you can share ideas and experiences, and help one another to get to the goal, and get to the career that you want to get to. So definitely, finding that purpose, and shadowing, but then with the, finding a community to help you is also very important.
Linda and Rostin, did you guys go yet?
I think only artists and musicians know what they need to do for the rest of their life. We have to all figure out our own paths for the rest of us. So pray that God will open doors that need to be open and close the doors that need to be closed, and that you will be okay with it. But first, find your passion. Find out where you're passionate. If your passion is kids, fine. If your passion is to be in front of a monitor, like your thing is to be in front of a monitor and maybe problem solve or program or do, then find that, but find out where your passion is.
I agree. Finding out what your passion is. I think everybody said it quite well. Knowing, like, seeking God in prayer first, and just finding that passion, and hopefully, you will make the best career decision possible.
I think I would also add is that sometimes failure is okay. If you decided that you wanted to go in a certain career and it didn't work out, it's okay to find a new passion, a new career. If you feel like your calling, if you fail along the way and you feel like this is your calling, it's okay to just get back up, brush your shoulders off, and continue in the path that God has called you to go on.
Yeah, like you said, Patricia, I remember in nursing school, we had a nursing student. After the second semester, he quit because he thought that was for him. And he realized that nursing was not for him. So he left. So yeah, you have to accept failure. You have to accept that You make mistakes sometimes, but you move on, and then there are other avenues for you.
And I also have a sort of opposite story where someone I know and went to med school with had trouble. He had trouble passing the boards and had trouble passing certain classes. But guess what? He eventually, passed his courses, passed his boards, and he's a physician today. And so there are, there's both sides of the spectrum. There are people who decide to leave that profession and go to something else. And there are people who persist and pursue and, are able to reach it with the right help. Okay, so we have about a little under 15 minutes left. Any last comments or questions from the audience or comments from our panelists? Don't be shy, guys.
Just wanted to say thank you just for the invite to be here. Miami Temple is that church is my home away from home. I'm all the way out here in California, but I miss that church community dearly. So every time I go there, it's pure joy. So just thanks for the invite and love you guys.
Great. Well, thank you everyone for being here today. We thank you, Vyomi, for your comment and your suggestion to have more options. Unfortunately, our pharmacist was unable to join us today. But thank you to our panelists. Thank you, Lance. Thank you, Rostin. Thank you, Chantal, Stacy, and Linda. Thank you for answering questions. Thank you for entertaining us today. And without further ado, I think we can go ahead and end here.
Okay. Bye.
Thank you.